Hello, my name is Trivedi, President and CEO of Sheppard Pratt, the largest private nonprofit provider of mental health, substance use, developmental disability, special education, and social services in the country. Our nation is facing an unprecedented mental and behavioral health crisis. Suicides are at a 30-year high in the U.S., and drug overdoses now cause more deaths in the U.S. than breast cancer or car accidents. And while these might seem the most dramatic results, all mental illnesses are on the rise. Diagnoses of depression and anxiety are escalating, affecting people of all ages. And while I mention statistics, the reality is there were many people who were struggling with mental health issues even before there was a COVID-19. What I'd like to do in the next few minutes is provide some tips as well as some ideas of what has worked for many of the people that I've worked with. And so as a physician, as a psychiatrist, as a child psychiatrist, I want to help you as you're facing maybe some of the most difficult moments in your own life. One of the difficult things with COVID-19 is that all of our regular schedules have been thrown off. We no longer have to get up at a certain time to head out for work. We no longer have to get the kids ready and out to school. And we also may not exactly have fun things that we do on the weekends or ways to connect in person with friends and family. What we are facing right now only magnifies all those issues. What I'd like to do is to focus on some things that I know have been helpful for the patients who I've helped. Number one, as much as you can, develop your new daily schedule. Figure out a time where you will wake up each morning. How will you get yourself out of bed? How will you make sure that you have a good, healthy breakfast? How will you take a shower, be dressed for the day, not spend the day in pajamas? How will you make sure that you're eating healthy food, that you're getting exercise, and most importantly during COVID, that you're giving your brain a chance to rest? A chance to rest means going to sleep at a regular time each night, getting enough hours of sleep each night. But rest also means turning off the TV, turning off your cell phone, avoiding social media, and not allowing your brain to be bathed in constant messages and worry and anxiety about COVID-19. It's been going on for weeks to months now. Unfortunately, what we do know is that we will be dealing with COVID for months to come. My hope is that you can turn things off, that you can avoid that impulse to check the next post on whatever social media platform you're using. In addition, it's also important that we think about our children and make sure that we are monitoring how much time they're spending on the screen. As I say all of this, like any health condition, whether you had diabetes or high blood pressure, you also need to manage your mental health issue. So, during times like this, it's really important to use a thermometer. And what I mean by that is not to check your temperature, but to be self-aware and to keep track of whether you're feeling more sad, more depressed, more anxious, more irritable, more keyed up. And I say that because the best person to know that you need to maybe take it easy, maybe do something different, maybe turn off the TV screen, is yourself. If you notice that you are getting more anxious, there are a few things you can do. The first one, the easiest one, the one that even a 3-year-old child can do, is deep breathing. And so what I say and what I teach to any of my patients is find a comfortable spot. Sit in a comfortable chair, make yourself feel rested and in that seat. What we're going to do in deep breathing is pretty simple, but it's also pretty significant. When we get anxious, we have a tendency to take really short breaths. We don't push that oxygen deep into our lungs. and we don't allow for that oxygen to enrich and to nourish our bloodstream. What does that do? It makes our entire body feel like it's not getting nourished, it's not getting enough oxygen, and that leads to more and more feelings of panic. And when I talk about deep breathing, I'm not talking about just taking a breath, have it go into your chest and come right back out. I'm referring to breathing where you take a slow, deep breath, and that breath fills up not your lungs, but all the way down in your belly. Your diaphragm is what you can feel moving. And as you do this, the idea here is that you're going to take a deep breath in, you're going to pull it in, you're going to hold it in for a few seconds, and then you're slowly going to let it out. What I would say to you is if you're doing this well, that entire process of breathing in, of holding your breath, and then letting it come out should take you about 10 seconds. What does that mean? In an entire minute, you will have 6 long, refreshing, sustaining, oxygenating breaths that will come through your body. The last part of what I'll say is the best time to practice getting better at deep breathing is not when you're completely freaked out. It's actually when you might feel closest to feeling not anxious at all. If I were to deep breathe, and I'm just going to show you this, what I would basically do is I'd get into a comfortable position, get my hands in a way that I feel feels comfortable to me, and then what I would ideally do is I'd close my eyes and I would start to breathe in. As I breathe in, I would want to take a slow but deep breath, and once again trying not to fill up my chest, but to fill up my belly or my diaphragm. And so early on, what may be really helpful is to leave your hands right above your belly. And as you breathe in, just notice, is your chest expanding or is your stomach expanding? So I would start breathing in. What I do when I breathe in is as I breathe in, I'm counting. And I count in for 1, 2, 3, 4 seconds. Then I hold it inside me. And I count 5, 6, 7. And then I slowly let out my breath for 3 more seconds. 8, 9, 10. I would do this repeatedly for about 3 to 5 minutes. The thing that I ask you to do is before you start this, just ask yourself, how anxious do I feel? Give it a number between 0 to 10. When you're done with it, ask yourself the same question, how anxious do I feel? If you practice this, I've had patients who are able to tell me, I was really worked up. I was up to a 9. I thought I was going to just completely flip out. And after 3 minutes, 4 minutes, 5 minutes of kind of just doing deep breathing, that 9 went to a 1 or a 0. And I say this having helped hundreds of people before. It's challenging enough to go through these life experiences, but they can be even worse when you don't know how to get help. At Sheppard Pratt, we are focused on ensuring greater access to mental health services to meet the needs of people who require our help. You can visit www.sheppardpratt.org for more information on our resources, programs, and services. I wish you peace and good health. Thank you.